So now, as promised, the interview that probably many of you have been waiting for all morning with the rising number of cases. Again, 210 yesterday at a CAR score of 22.2. This morning, 109 positive cases.
189.
189, thank you. Positivity rate of around 15%, causing the CAR score to go up to 37.9. So our good friend, learned physician, Dr. Hoa Nguyen from American Medical Center is joining us right now in the KOM News Zoom room.
Good morning, right. Doc, I want to say last time we had you on, you were zooming in from sunny Florida, and I believe you said buckle up in January, and I hate it when you're right. You're a great guy. I love you, but I hate it when you're right because you were right about the Delta surge. You were the leading voice early on calling for restrictions, right? I mean, you were at the head of it. And the rest is history. That was just a terrible, tragic surge, and you were calling for us to prepare for Omicron, and here we are. So I guess just right off the bat, is this Omicron on Guam, in your opinion?
Yeah, it's most likely is Omicron already arriving in Guam, and it's but we still cannot forget that we still have Delta in the community. So that's the scary part. The Omicron would be very much a lot more contagious than the Delta, but it's not as deadly. So when we have a lot of gathering especially with the vaccinated people, you're going to have an increased risk of passing on and have a resurge of the Delta variants. But Omicron will be here. It's going to be here for the next several weeks until it kind of burn out. And the question is how long it's going to burn out. It's going to take 4 weeks, 6 weeks, or 8 weeks. Well, we don't know. But I know that we have ordered a machine to kind of do the genome sequencing that hopefully will come in soon. That will kind of shorten the time for us to kind of find out that Delta or Omicron. But right now, you got to assume that both of them is out there in the community at this point. So our people in Guam have to be kind of modify their behavior, their lifestyle in order for us to try our best to control the surge. But I think we are in it at the beginning. So more likely it will get worse in the next week to 2 weeks or so.
Doc, my WhatsApp's been blowing up from physician colleagues of yours, and they're concerned about how ready the Guam Memorial Hospital is.
We are not in a good shape. Beside the COVID admission, the non-COVID admission are in the rise also. I mean that you have the typical poor control diabetic, you have typical stroke, heart attack, and infection are coming up. This is post the Christmas and New Year, where now diet and now lifestyle are not good. So right now the admission for the non-COVID patient are very high. So whenever you have a COVID patient in there, you really take away the nursing staff and the people to treat the non-COVID admission. So I know that we keep saying that it's non-ICU, not an event, but we gotta understand that every admission for COVID patient, you will take a lot of time, a lot of staff away from the non-COVID admission, which is detrimental to people that typically get admitted for complication of their chronic illness. So you don't have to be ICU, you don't have to be a vent, but again, it takes a lot of staff and the care away from other people in the hospital.
Doc, what are you seeing at the clinic level at American Medical Center clinics?
Yeah, I'll walk-in visit for sick visit for cough and cold and COVID-related symptom. We max out. We cannot. We had to turn people away because we can't take anymore. So I think that at FSP and SDA, they seem the same. we pretty much max out on sick visit at this point, and it's going to get worse. And then I really ask people to practice the 3W, and try your best and not have any gathering. We at AMC, we scheduled to have a get together, like for our staff this January 15. We decided to cancel it. We can't take the risk of have everyone in the same place, and one person gets sick and it's going to spread throughout the whole staff. So we basically cancel our party on January 15 just because there's too much risk out there. So I'm going to ask other companies to do the same thing, to be responsible and do that so we can help, kind of curb this surge as much as possible.
Yeah, Doc, I know that routinely a lot of businesses and companies, especially if they're open during the holidays and they got all their customers, they usually have like their holiday party, right, for the staff or whatever, in January. So you're just advising people to kind of take it easy on that because there's no guidance.
Yeah, I would advise them to move it, to delay it for several weeks. And again, it's protection for their company, right? I mean, if the Omicron have its way, and people, the staff for different companies will be positive, and they're going to be missing work for at least 5 to 10 days. And just like anywhere anywhere else in the state, you have to curtail your business just because you don't have staff. They all are positive. So I would ask the company, if you plan for any party in January, just move it until this number coming down, and it should be sometime, I don't know, February or something. That's when it's going to come down, hopefully.
What about sporting events and that kind of stuff?
The sporting event, the same. I mean, you really need to be masked up and social distance and make sure you don't you don't sit too close to someone you don't know, because anyone else can be sick. So you just have to be careful. I say you got to protect yourself, protect your family. Every family in Guam have people with comorbidity, and I know the Omicron is not as severe as Delta, but with people with comorbidity, you can end up in the hospital still. So just be careful.
Right, and so I want to key in on what you said there, Doc. You said it's less severe than Delta, but with the comorbidities, right? What other risks are, or what other areas are we exposed at? Are we also a little more exposed because our booster shot campaign isn't maybe where we want it to be?
Yeah, I can see, and I read in the news that and you can see in the JIC that the vaccinated are more now in number in the hospital than unvaccinated. And as I tell you before, our booster rate are so low at this point that if you are 4.5 to 6 months out from your second shot and you don't have your booster, you will get sick. And the chance that you will be in the hospital is much higher than if you have the booster. So I encourage people to go out there and get the booster as much as possible. It will not prevent you from getting sick if you don't be careful and don't practice the 3W, but it does decrease your risk of end up in the hospital. That's what we're looking for, is the people admission to the hospital with or without ICU. It doesn't matter, So you need to go out there and get the booster for the Omicron, and also remind people that, even if you're infected with the Delta a week or 2 weeks or 3 weeks ago or a month or two ago, Omicron will reinfect you. The infection with Delta does not protect you from the Omicron. So, so everyone start up at square one. Unless you get infected by Omicron and get immune for it, you will get infected if you drop your guard. So that's something that people have to remember. And, so go out there and get the booster, as soon as possible to get yourself protected from the Omicron that will put you in the hospital. So I know we had to push that booster as much as possible. And also, I know we have the Regenco or monoclonal antibody in one, but you have to make people fully understand that the Regenco or the monoclonal antibody does not work against Omicron. Okay, we don't have any therapeutic for Omicron at this point, but we still need to give people the monoclonal antibody in case they have Delta, because we cannot forget that Delta and other variants still out in the community, and the monoclonal antibody does work against them to cut down about 80-85% the chance of them to be in the hospital. But against Omicron, it doesn't work. Against Omicron for monoclonal antibody.
Doc, so we got a message yesterday from Public Health that so they're doing the testing in TGen, but they're only doing it from 8 a.m. to 11 a.m. And Public Health actually asked for our help yesterday to announce those limited hours for testing because people kept showing up to get tested and they were turned away. So, we were told to prepare like it's a super typhoon, and it kind of seems like the super typhoon's here. So should we be turning people away from getting tested for COVID-19 in this surge?
Yeah, I'm not quite sure why we only test 3 hours a day. We should be testing much longer than that. For every infection you have out there that's positive, there are at least 3 or 4 more out there that is positive but is not tested. So you, at this point, you want to be tested as much as possible. And to me, the hours should be longer, and there should be more site on the testing. But 3 hours a day, people show up and they got turned away. Sooner or later, if they're positive, they're not tested, they're going to start spread out to other people in the community. And our people are very good. I tell you, if you tell them positive, they will stay home and isolate away from other people. And that's the wonderful part about people in Guam is that they're very compliant if they know they're positive. So I would say that you don't turn people away until the line is 0.
Doc, what about reporting some of these positives? Because it kind of seems like so GDOE is reporting their cases that they test out at the schools, but previously during this pandemic, if you had a government agency had an employee who tested positive, they would report it. But I know of several positives scattered throughout GovGuam, some at the governor's office, some at different agencies, but I haven't seen anything reported. What do you make of that? That we're 2 years into this thing and we're just doing things all different all the time.
I think the place like GDOE, because you have involved the student, that you should be reported so public would know. At any agency, I don't see the need to let people know just because they not really have a lot of come in a lot of contact with our people. But at the school, they have to report that just because the parents need to be comfortable and send their kid to school. So that's something that you have to do. And Chris, another thing is you're gonna see a lot of positive. I tell you, most of the positive that we have right now is the fully vaccinated one. I know they don't report that, and people asking, and again, the fully vaccinated, but it's not boosted, they will turn positive because, like I say, there's no restriction on the gathering on the fully vaccinated people, and especially they behind, on their booster. And but there's a few places like Hawaii consider that you're not fully vaccinated, you get the boost. You have to get the booster. So it might come that way that we might consider that, hey. We used to call it pandemic of the unvaccinated, but I think right now it's pandemic of the fully vaccinated, just because they are without restriction and with the gathering, so they're going to be a lot more positive in the fully vaccinated unless they get the booster, So because the unvaccinated, they're very careful and they don't have a chance to mingle in a crowd like the fully vaccinated. So I think our effort right now is number one is to really stop segregating the fully vaccinated against the unvaxxed and the boosted one. We should basically get rid of that. Time change. When you have this high percentage of people fully vaccinated already, we got to stop segregating them and basically concentrate on our effort and get people get boosted. And that's our effort supposed to be, is get people get that third shot. But at the fully vaccinated, most of the positive will be the fully vaccinated.
Doc, I mean, just anecdotally, I know someone who is fully vaccinated, caught Delta, and then they just got infected again.
Yeah,
So,
because Omicron will reinfect the Delta infection.
right. Yeah. So, I mean, it's real.
Also, if you have Delta infection in the past 3 months, please be careful still, because Omicron will reinfect you again, because that's how it is. But the good part about Omicron is that if you get infection and you happen to do well, then you are immune for a while, because nothing else going to supersede that one. But for right now, we just have to be careful. The theory of let the thing go, get this natural course, can be a dangerous theory to go with, just because, again, we will lose people in life, and we lost enough life already.
I mean, that seemed like that was the policy during the Delta surge, right? So what's up with your buddy Dr. Berg? Is that his advice to the governor, is to just let the Omicron run wild and then everyone will have super immunity?
I don't know. That's a approach that can be very dangerous. Like I say, this it can really hit you when one of your family member turn positive. Then that's when it hits you. But again, that's what you don't want. So I think that again, if you don't put any restriction anything that on people at this point, the main campaign right now is get people to be boosted, to try to prevent the hospitalization, and try the best to do the campaign and educate the parents on the vaccination on children. That's something that I didn't talk about, because Omicron affected children a lot more than any variant in the past. So we have to make sure that we provide a good campaign, a good educating material for the parents to get their children to be vaccinated from 5 and up, just because, again, Omicron affect children much more than any variants we have in the past. And we know that. We have data to show that.
Thank you, Doc.
You're welcome, Chris. But yeah, I say buckle up. And everyone have to do his own part. And again, if the company, if you have party, be responsible and kind of delay your party. We did for our party. We can delay it. There's some safety for your employee is the main concern for everyone.
Thank you, Doc.
You're welcome, guys. Be
right.
safe.
Oh, we will.
Okay.
Yeah. We hate it when he's right, but we'll take him anyway. Dr. Hoa Nguyen, 852.